Hi, I'm Greg Corombos. My guest at this time is Dr. Roger Klein. He's an expert with the Regulatory Transparency Project's FDA and Health Working Group, and he's the former medical director of molecular oncology at the Cleveland Clinic. He's also advised the FDA, the CDC, Health and Human Services, and the Center for Medicare and Medicaid Services. So he knows about government response, and he certainly is an expert on the situation that a lot of folks are focused on right now, and that's coronavirus. Just how bad is it? Just how many precautions do we really need to take here? And Dr. Klein, thanks so much for being with us.
Yeah, hi, Greg. Thank you for having me on.
Well, let's talk about, first of all, what we know for sure, because we've got certain numbers coming from China and other countries. At the same time, though, we are hearing from more and more places that we're not sure how accurate the tests are for coronavirus. So how do we gauge exactly where we're at right now?
The numbers that we're seeing from China, I think we have to look, and that's where the vast majority of cases, almost 95% of the cases are still in China. There's, roughly 5,000 cases outside of China. I think the tests, in fact, are probably accurate. What we're not catching is we're not catching the people in China, for example, who don't have symptoms or have very mild symptoms and aren't coming to medical attention, or those who, for some reason or another, aren't getting tested because because of lack of supply, for example. So I think the numbers are certainly an understatement in terms of, or likely an understatement in terms of the numbers of people infected, but then that cuts both ways, because the virus itself is we're probably missing the mild cases or asymptomatic cases, so the virus is probably less virulent or harmful than it may initially have appeared.
Well, let's dig into that, because if it's mild or asymptomatic, there's potentially a lot of people out there who might just think they have a cold, right?
There could be, and we really, I don't think we have a good handle on that. That's a two-edged sword, and I think this is not different than flu in that respect. We have people who are who don't have symptoms and walk around, and then we have people who get very sick. But when you talk about the case fatality rate or the death rate, it's almost certainly overstated right now, because the sickest people are coming to medical attention, and the rate in China is higher than elsewhere in the world, and we haven't had a single death here. We have 60 people now that we know of who are infected.
So one of the things that always gets discussed around stories like this, Dr. Klein, is whether the media is being responsible. On the one hand, they want folks to be aware. On the other hand, I've seen some medical professionals say the media is way overhyping this. Yes, people need to be aware of it, but this idea that there's going to be just mass chaos throughout the world because of this is horrifically irresponsible. So from what you've seen so far, how would you grade the media's coverage of this?
What I think is right now we seem to be in a panic phase, and I think we're overestimating or overstating the current risk. We only have 60 people here who are affected in the United States. So people are walking around with masks, and they fear that they're going to be exposed to something that isn't circulating. At the same time, they're not getting flu shots. The flu kills 40,000 people a year, and we have means to protect ourselves, and only 37% of adults get flu shots. So I think we need to put it into perspective. We've got 5,000 cases outside of the United States. Even in Wuhan, China, the epicenter of this outbreak, fewer than 1% of the people. They have 11 million people there. Fewer than 1% have been infected that we know of so far.
You've worked with the relevant agencies that are responding to this, the Centers for Disease Control, the Health and Human Services, and so forth. What's their general protocol for this? So what happens whenever there's a threat like this? I know they're generally prepared for outbreaks. They might not know exactly what's coming, but what is generally the plan, and how well is it being executed as far as you can tell right now?
Well, we also, in addition to the CDC, we have 50 state health departments,
right,
and they generally work hand in hand. And what happens is they, and also emergency departments and hospitals, and they set up protocols and distribute protocols and have and we establish surveillance. And that's really what we need to do right now, is establish surveillance and to spot. If and when we get community transmission, so that we can be we can identify it and isolate people and watch them. That right now we don't have medicines to treat it. We don't have vaccines. We need to make sure that we have adequate treatment facilities to provide supportive care. Yeah, but I think they're doing the right thing. They have done everything that they can, and we're watching this. The one area in which we potentially could improve is we have very small numbers of labs testing, a small number of public health laboratories. There are laboratories across the country, excellent laboratories, both commercial and academic, who could perform this testing. There's already kits that I saw a press release. I don't know anything about the company, but that they're already approved to sell. They have CE mark to sell it in Europe. There's a company that's now submitting to the FDA. I saw the chief executive officer on television today, who's and I know the company. I have confidence they can create a good test. We need to get testing out in the market. We need to have broader and more widespread testing. Even though most of it's going to be negative, these hospitals want to test, and we want to be sure that we're on it early if and when it starts to show up in a broader way.
Dr. Klein, the last topic I want to get to here is China itself. There's been a lot of speculation that China has not been forthright about the numbers or its effectiveness in dealing with it. What's your recommendation to make sure that the information that our government is getting from China is in fact accurate?
Well, I think we need to look at it in more than one way. Yeah, I mean, I don't know how it's sort of a communist country. I don't know how much we can rely exactly on the information that's provided. WHO is also working with them. I think they're somewhat assessing the quality, but we also have to look at their ability to report. China has reports almost no flu deaths. How is that possible? How could China have such a low flu rate? Because they don't do the type of analyses that we or other Western countries do. And I think there's also a level of competence here. And we can't overestimate that this is not the United States. This is not a rich country with an established, a well-established infrastructure the way we have. And I think we've also got to consider that.
Dr. Klein, there's a lot to watch here going forward, but as you've pointed out, the risk at this point in the United States is extraordinarily low. 60 cases confirmed, we believe, at this point, and no fatalities. And for the most part, other than folks with compromised systems, it's expected if you do get it, it's not all that severe. So, but we will see, and we thank you very much for your time today.
Thank you very much for having me.
You bet. Dr. Roger Klein is an expert with the Regulatory Transparency Project's FDA and Health Working Group, former medical director of molecular oncology at the Cleveland Clinic, and a former advisor to different government agencies, including the Food and Drug Administration, Centers for Disease Control, Center for Medicare and Medicaid Services, and the Department of Health and Human Services. I'm Greg Corombos. This is Radio America.